Hi, I wanted to address disparities as one of my discussion posts, how I would move forward in addressing disparities. Also, too, an example at my facility at Telecare. One of the tools and process we use to addressing disparities is part of our intake. When I am there doing an intake with a client, um, getting them through the process of assessment and treatment. The aftercare plan has initial surveys. So these surveys are for each individual to share how they felt, if they were addressed correctly, if their needs were met, if they felt comfortable and safe, if they felt like they were treated equally with dignity and respect. Along that, when I give them these surveys to answer themselves or usually the outcome is pretty good. They feel like I was empathetic, or the staff around them was empathetic, and to really listen to them and their needs and concerns, and that interpersonal, anything that, skill that comes into play. So I feel the assessment is a key to the demographic where I am in San Bernardino, to addressing any disparities. I think that people accessing the service are openly and free and safe to answer these questions. Feel if there was a need that wasn't met, then later on when we see that supervisor, will be kind of go over it, discuss it, say, hey, if you ever run into the situation, make sure you talk to the lead, connect with the supervisor, in addressing the situation this presents itself again. A lot of the training we get prior to our getting into telecare is um, we do assessment, we do the disparity training, we do cultural sensitivity training, cultural humility. We have a lot of things in process to make sure we're just, you know, tailoring things to each individual in this demographic too. So cultural competency is a key. I like this fact that we have to go through training in case we encounter any situation like that. Just our cultural competency training, education for staff to increase awareness and understand diversity groups and experience and needs, and topics about bias, cultural humility, communication strategies for working effectively with this population, individuals with different cultural backgrounds, ethnic, ethnic and linguistic backgrounds. I had a coworker who had sign language experience, so she could assist a member who was experiencing loss of hearing, and she started using sign language, and immediately you could see the rapport build, relief of the stress of the member, and the connectivity. So they were able to connect with them genuinely, empathetically, and order to betterly meet their needs and treat their mental health issue and get them to the provider, and just good application of that effective communication. It's just accessible. We accommodate everyone. I like that fact that I learned a lot. There's a lot of new things that I did learn too. Um, so there's ongoing data monitoring and evaluation of any disparities or any issues, anything that comes up, um, that identifies a trend, or just a continually improvement, for efforts to treating the individuals there at telecare. I really like that. I also learned that when there's an instance where, we always have room for growth, something to learn, implementing solutions is a real key to. I really like the fact that That's embedded within their practice and policy procedures just to promote equity and addressing disparities effectively. We're always encouraged as staff to participate in identifying areas for improvement in ourselves, even during, we have clinical group supervision via Teams, and that's one of the tools our supervisor had used at Telecare to train the interns on how to approach biases just by taking proactive steps, working towards addressing disparities and promoting, I like what he said one time, healthy equity. And at Telecare Crisis Stabilization Unit, I really enjoyed. I was stretched. I grew a lot there, and every individual member I had contact with, and it was just a great experience there. It gave me more confidence to address things that are there, and being comfortable with being uncomfortable and addressing things in a appropriate aspect, and making individuals receive the support and care they need to achieve recovery and well-being. And that's the greatest part about being a social worker, is gaining these skills and cultural competency in order to better serve the community. And I hope you enjoy this discussion here. Thank you again for your time, Professor, and everyone. And you guys have a great summer. Bye. Thank you.